So you're part of EMS 10. You're responding to a private residence for a woman down. Caller states she just found her grandmother in the backyard.
All right, got my BSI on. We all got our BSI on. We're gonna make sure the scene is safe at all times. Make sure that I'm safe, my partners are safe, and that my patient is safe. We're safe?
You are safe.
I'm gonna check the environment and make sure there's no hazards around. Are there any hazards?
There's some chihuahuas around and there's gardening tools scattered around.
Okay, we'll make sure that the dogs are locked away in the house and not on the scene, and be mindful of the tools and get them out of the way so we can access our patient. How many patients do I have? One patient. I'm going to go with mechanism of injury. She's down in the back, so we're not too sure of its nature of illness, but we're going to go with mechanism for now. Additional resources, since she was found down on the ground, I'm going to call ALS. Probably not very responsive, so activate ALS, have them en route. And need for SMR, I'm going to bring my backbone and C-collar and have my patient hold, or my partner hold C-spine at this time. So as I approach my patient, I'm going to do my general impression. I see a elderly female down on the ground laying supine. Is there anything else that I see?
No, the patient just lying there isn't moving.
Okay. Are there any life threats?
None that you can see.
Okay, I'm going to tap and shout, ma'am, can you hear me?
No response.
Okay, I'm going to go ahead and do interdigital pressure. Any response to painful stimulus?
No response.
So my patient's unresponsive. I'm going to go ahead and check the carotid pulse and check breathing at the same time.
You feel a carotid pulse and see chest rise.
Okay, I'm going to go ahead and have my partner do a jaw thrust maneuver to see if there's anything in the airway.
You see some loose dentures.
Okay, I'm going to remove the dentures. Hopefully they have a patent airway.
Yeah, their airway's patent.
Okay, we had some chest rise, but what is the tidal volume and the effort in the breathing?
Her breathing is rapid but very shallow.
Okay, I'm going to have my partner start a back valve mask since she has shallow breathing and she's unresponsive. I'm going to go check circulation. What is the cap refill?
Greater than 2.
Okay. Pulse, the radial pulse?
It's weak.
Alright. Any obvious signs of bleeding?
No.
How are her skin signs?
She looks pale, cool, and diaphoretic.
Okay, it's definitely signs of shock. We already got her supine. We got her on a BVM for oxygen. We're going to keep her warm with a blanket as appropriately as we can. And then we're going to rapidly transport once we finish our assessment. Is there any deformities or disabilities at this time?
None.
Okay. Gonna expose the patient. Do I see anything else at this time?
As you exposed her, some warfarin fell out of her pocket.
Warfarin, okay, so she's taking blood thinners, definitely going to cause some problems for a trauma patient. We're going to suspect maybe some internal bleeding. My field impression is that I have a unresponsive elderly female, about 70 years old maybe. She is showing signs of poor perfusion, signs of shock. She has shallow breathing. We've got her on a BVM. We are activating ALS. How far is ALS?
ALS is about 10 minutes out.
Okay, and where's the nearest trauma center?
20 minutes away.
20 minutes, okay, so it's a high priority patient. We're waiting for ALS to get here. We're going to transport code 3 to the trauma center as soon as you get here. I'm going to move into my secondary assessment. I'm going to check for DCAP and BTLS, so deformities, contusions, abrasions, punctures, penetrations, burns, lacerations, tenderness, and swelling, and also instability and crepitus. So I'm going to go ahead into the head. I'm going to palpate the skull and check for any blood or anything. Do I see any blood on my gloves?
No.
Okay, I'm going to palpate the forehead to make sure that the forehead is intact and the orbits of the eyes, are they intact?
They're intact.
Okay, I'm going to go ahead to check the pupils. Are they prone?
They are.
Okay. I'm going to palpate the zygomatic cheekbones, the maxilla, and the mandible. Are those all stable?
Yes.
Okay, we can check again in the mouth to make sure that she doesn't have any additional obstructions. Is the mouth pain?
Mouth is pain.
Okay, I'm going to check the ears. I'm going to check the back for any battle signs, any CSF or blood coming out of the ears.
You don't find any?
Okay. So the head is, and in the nose, I'm going to check for any blood or CSF or soot or singed hairs in the nose.
All negative.
Okay, so the head is clear. I'm going to come down to the neck and check for tracheal deviation. I'm going to check for any JVD on the side. I'm going to check for any subcutaneous emphysema, any medical alert tags. I'm going to check the back of the neck for any spinal step off. Do I find anything?
All negative.
Okay. At this point, I'm going to put on my C-collar. I'm going to measure. Alright, C collar's on. Down to the chest, I'm going to check the clavicles. Are they stable?
They're stable?
I'm going to check the shoulders, pushing down and in. Are they stable?
Yes.
I'm going to check the ribs by doing a barrel hoop. Are they stable?
All ribs are intact.
And the sternum, doing a sternum rock.
It's intact.
Alright, I'm also going to look for any unequal chest rise, any paradoxical movement, any entry wounds, gunshot wounds, sucking chest wounds. I'm going to check lung sounds. How are my patient's lungs?
They're clear bilaterally.
Okay. I'm going to move down to the abdomen. I'm going to go ahead and palpate the 4 quadrants. I'm checking for Dr. Gem, distension, rigidity, guarding, ecchymosis, or any masses pulsating. Do I see any of those?
Yeah, when you palpated, you felt some distension. The patient grunted, indicating some signs of guarding, and you see ecchymosis.
Okay, so she grunted, so she's responsive to painful stimulus now, which is doing a little better. But the distension and guarding, so showing some signs of some trauma or some kind of bleeding in there. She's on warfarin, so that's not good at all. We're treating her for shock. I'm going to move down to the pelvis. I'm going to push down and in. Are the pelvis stable?
It's stable. You also see that she's incontinent ×2.
Okay, I'm going to check for incontinence. If she was younger, we would check for signs of pregnancy, or any bleeding, and if she's incontinent. I'm going to come down to the legs and check offset pressure. Are the femur stable and the tib fib stable?
Yes.
And the patellis, they're stable?
Yes.
Okay, I'm going to come around the feet. I'm going to check bilateral pedal pulses.
You feel them?
Okay. If she was alert, I would have her wiggle her toes and tell me to check sensation. If she is not, so I'm going to come to the arms. I'm going to do offset pressure on both arms.
As you look at the right ulna, you see a closed fracture.
Okay, so she has a deformity in the right forearm. I'm going to check bilateral equal pulses.
She does have pulses in both.
Okay, if she was awake, I would have her wiggle her fingers and then tell me which finger she was touching. At this point, I'm going to have my partner grab the backboard and we're going to, can you place the backboard over here, Chester? We're going to log roll the patient towards me so that we can check the posterior side and then get them on the backboard. Perfect. When I log roll the patient, can you wedge the board in there?
Yes, sir.
All right. If you could, on your count, we're going to log roll the patient towards me.
All right, on 3. 1, 2, 3.
On the back side, I'm going to go ahead and check lung sounds back here. Expose the back. I'm going to also check for spinal step off.
You don't find any?
Then I'm going to check for any sacral edema. I'm going to check for any exit wounds. I'm going to check for any incontinence or any bleeding.
She's still incontinent ×2. Her lung sounds were clear bilateral, no other pertinent signs.
Okay. We're going to log roll the patient back down to the board on your...
All right, on 3. 1, 2, 3.
All right. So we're going to do a V-slide maneuver. If we can get the straps out from under the board first. All right. So Chester, if you could foot the board for me.
Okay.
And if you could also grab the hips, I'm going to come up here into the armpits. So we're going to slide the patient down towards you and to the patient's right on your count.
1, 2, 3.
All right, we're going to go up into the patient's right on your count.
1, 2, 3.
All right, patient's on the board. Going to go ahead and strap the patient in. Since they are unresponsive, I'm going to strap the patient's arms in. Not tying those down yet. Alright, as she delivers a breath, I would go ahead and tie these down so that we get full chest expansion. I'm going to go ahead and check CMS one more time.
You feel it?
Okay. We can't check motor sensory. I'm going to check bilaterally.
You feel the pulses?
Okay, at this point we can go ahead and secure the head. Get your knees off real quick. Using the tape. If you could take from the bottom of the board for me, Chester, right about here.
Yes, sir.
We aren't going to tape on the skin. Trying to avoid the eyebrows. Taping to the bottom of the board. Now that the patient's secured to the board, we can go and get some vital signs. What's my patient's blood pressure?
86/42.
Really low. Eyes we got earlier, they're still pearl.
Yes.
Lung sounds we got are clear bilaterally. Level of consciousness we determined was unresponsive. Skin signs, is she still pale, cool, diaphoretic?
Yes.
What's the respiratory rate?
30 and shallow.
Okay, and what is the pulse rate?
126 and weak.
Okay, so definitely showing some signs of decompensated shock. We're going to reassess every 5 minutes. What is my secondary set of vital signs?
80/40. Still pearl. Still ANO times 0. Lung sounds are still clear bilaterally. She's definitely still cool, pale, diaphoretic, but her respirations are now 22 and shallow, and her pulse is 118 and weak.
Okay, so she's decompensating. We're going to wait for ALS. Hopefully they get here soon and we can transport code 3 to the trauma center.